All right. Well, welcome everybody. I want to thank you for joining us for tonight's Ask the ARC webinar. We're here with Kim Colley, the Quality Assurance Director for the Bureau of Disability Services, and Shelley Thomas, the Director of Outcome Management with the Bureau of Disability Services. If you notice, there's been a slight name change. Effective July 1st, the Bureau of Developmental Disability Services has become the Bureau of Disability Services, just making it more inclusive and reflecting all of the different work that they do. So ladies, I want to thank both of you for joining us tonight. And tonight we're going to talk about incident reporting. And that's something that is an incredibly important topic. And yet it's a topic that a lot of self-advocates and a lot of families aren't really sure about. So I want to thank you both for joining us to be able to talk about this tonight. I also want to stress that, first of all, we are recording this session. So you might want to be mindful of that as you are asking questions. By all means, you are welcome to put questions either in the Q&A or in the chat, and we will get to those as we go along. So thank you for joining us. And at this point, I'd like to turn it over to Kim.
Thank you, Carly. Thank you so much for inviting us. Happy to be here to discuss this topic. Like Carly said, my name is Kim Colley, and I am the Quality Assurance Director for the Bureau of Disability Services. Before we get started, as a reminder, our core beliefs are really surrounded by all people having the right to live, love, work, learn, play, and pursue their dreams. States who operate a Medicaid waiver program are required to implement an incident reporting system to monitor and protect the health, welfare, and safety of the individuals receiving services. These requirements come directly from the Center for Medicare and Medicaid Services. So what is a reportable incident? A reportable incident is any event or occurrence characterized by risk or uncertainty, resulting in or having the potential to result in significant harm or injury to an individual. All case managers, provider staff, and bead staff are required to report any incident that meets the criteria of a reportable incident. A couple important definitions to related to incidents are emergency intervention and mandated reporter. Emergency intervention means the use of restrictive interventions during a behavioral emergency, only as necessary to protect an individual or others from harm. Mandated reporter means all provider staff, case managers, bead staff, physicians, or other related persons. Mandated reporters are required to report alleged, suspected, or actual abuse, neglect, or exploitation of an individual and any other incident that meets the criteria of a reportable incident. It is important to note, however, that although BEADS is a mandatory reporter, BEADS does not have the authority to remove someone from their home and/or family or caregiver. Reportable incidents include, but are not limited to, alleged, suspected, or actual abuse, neglect, and exploitation, peer-to-peer aggression when it results in a significant injury, elopement, alleged, suspected, or actual criminal activity, significant injury, a fall resulting in an injury regardless of the severity of the injury, medication or medical treatment error, use of aversive techniques including but not limited to seclusion, painful or noxious stimuli, or denial of a health-related necessity, PRN medication related to a behavior, or physical or mechanical restraint. Again, this list is not all inclusive, but you can find more information on the link. That link is included in the slide that will go out, but it's www.in.gov/FSSA/DDRS/files/incident reporting and management. It's also important to remember that when a reportable incident is discovered in which an individual receiving services is determined to be in danger, the person making the discovery will also call 911 if indicated, initiate safety actions for the individual as indicated and as is possible, If a provider discovers the incident, he or she will contact the case manager or case management crisis line if the case manager is not immediately available. Contact a manager within the responsible provider company, as well as the BEADS district manager. Notify APS or CPS as indicated, and notify the individual's legal representative if applicable. As a reminder, notifying APS or CPS is a requirement by law per Indiana code. Incident reports are filed with the Bureau of Disability Services using the DDRS approved format. That format will also be available. I went to the wrong slide. I'm sorry. Initial incident reports or IRs must be submitted within 24 hours of the incident or of receiving knowledge of the incident. The provider responsible for an individual at the time of the occurrence shall submit the initial IR. Should the individual not be receiving services at the time of incident, for example, if he or she is visiting family or having alone time, the first provider to have knowledge of the occurrence is responsible for the initial filing. In addition to the provider's mandatory reporting, I really want to point out that any other person may submit an initial incident report. All those incident reports are filed with the Bureau of Disability Services using the DDRS approved electronic formatting. That website will also be available on the slide. So as far as the incident reporting process, once the initial IR is submitted and forwarded to the applicable parties, it moves to the Bureau of Disability Services or BEADS to determine if follow-up is needed. Until the IR is closed by BEADS, the case manager is required to follow up on all IRs, submitting a follow-up report and forwarding it to all entities every 7 days until the IR is determined closed by BEADS. The entity filing the initial IR must forward a copy to the following parties as applicable within 24 hours of discovery of a reportable incident. APS or CPS for all allegations of abuse, neglect, or exploitation, or if a death has occurred. The individual's legal representative, the individual's BEAD service coordinator, the individual's residential provider when receiving residential services, the individual's case manager, and all other service providers identified in the individual's person-centered individualized support plan. When filing an incident report, it is important for the reporting person to complete the narrative portions of the form, including a comprehensive description of the incident, the circumstances and activities occurring immediately prior to the incident, any injuries sustained during the incident, immediate actions that have been taken, as well as actions that are planned but not yet implemented, and listing of each person involved in the incident. Persons should be identified by first name and last initial, a description of their role, for example, housemate, and staff title if applicable. Ensuring an incident report contains clear quality information by meeting the basic expectations for content. While this is also key to submitting IR follow-ups, it is especially important to include all pertinent details in the initial IR to assist with finding a prompt resolution that secures and maintains the health, welfare, and safety of the individual. Content should meet standards in 2 categories: general content and incident-related details. Providers and case managers can ensure quality IRs by meeting the standards of information needed in those two categories. It's imperative for initial IRs to contain the comprehensive information of who, what, where, when, why, and how in a clear and concise manner. Providers and case managers should include enough specific detail to fully explain the situation while ensuring the content is succinctly written and logically organized. Providers and case managers should keep in mind that many different people will be reviewing IR documentation. A person outside the situation should be able to read and clearly follow the chain of events without being confused or overwhelmed with unnecessary or unclear details. Remember, it is easier for the reader to understand the IR, the less likely it will be for reviewer to need to come back with follow-up questions or request additional clarifying information. The information that answers who, what, where, when, and how should be written in a way that clearly outlines the incident without the writer's opinion about the events. More information is available on our BEADS policy, Incident Reporting and Management, which includes additional directives for providing comprehensive and objective information in the initial incident report. Now that we've covered some of the general expectations regarding IRs, let's look at how they affect the second component of the IR, the incident details. You already know about the who, what, where, when, why, and how, but what does that include? So let's start with the who. Everyone involved should be identified by their first name and last initial. If needed to provide clarity, a preferred name or nickname may be included in parentheses, a description of the role and staff title if applicable. Additionally, the IR must include who reported the incident. Did the individual say the incident occurred? Was the incident witnessed by a staff person or family member? An accurate and factual IR must include these important details so a thorough investigation and prompt resolution can take place. Now let's look at the what of the incident. A comprehensive description of who did what and when includes a detailed but succinct description, including the actions or activities surrounding the incident. What was taking place immediately before the incident occurred? Does the individual have a history or pattern of this type of incident occurring with the same people involved or the same time or place? Were there any applicable risk plans in place at the time of the incident? If so, the IR should indicate if these plans were being appropriately followed at the time of incident. Was a restraint or hold used during the incident? If so, the type should be indicated, or the length of time it was used, and whether or not it was part of an approved behavior support plan. Was there an injury? If the incident resulted in any sort of injury, there are additional details that must be included in the description of what happened. The IR should not only outline who sustained the injury and how it occurred, but also include a description of the injury and the body part affected. For example, a 3-inch laceration on the lower left arm or a purple bruise in the shape of a heel print on the right thigh. If the injury required any type of treatment, the IR should detail what treatment was given, by whom, and the location where treatment was given. Should the injury require a trip to the emergency room, an urgent care clinic, or hospital, the incident report should indicate the name and location of the facility, any testing completed, the diagnosis determined, and discharge instructions, in addition to the description of the treatment provided. The final portion of detailing what happened is the description of any outcomes resulting from the incident. An initial IR should outline any negative outcomes, such as neglect, unwarranted or unsafe supervision of the individual. However, the outcomes may also be actions to mitigate the incident that occurred. If the individual was relocated as the result of an incident, meaning a removal from the setting, even temporarily, the IR must include the site information for the new location. Include whether it is a home or business, street address, and city of the relocation. For victims of alleged abuse, neglect, or exploitation, the IR should detail what, if any, types of supports or counseling are in place. Remember, succinctly and accurately including all applicable information in the initial IR helps to ensure prompt and appropriate resolutions that helps to ensure the health, safety, and welfare of the individual. Case managers are responsible for submitting timely follow-up reports for all incidents involving CIH and family support waiver participants. IR follow-up reports must be submitted using the state-approved electronic incident reporting system within 7 days of the initial report. Additional follow-up reports are required every 7 days until such time as BEADS declares the incident closed. Case managers are required to forward copies of each follow-up report submitted to the same entities who received a copy of the initial incident report. Providers responsible at the time of the incident, if applicable, should provide that necessary information to the case manager. Only BEADS has the authority to close an IR. So what does BEADS do with incident reports? First of all, BEADS processes all initial and follow-up incident reports. We flag specific incident reports for an investigation or continued follow-up. We conduct analysis on incident data to track and monitor trends with individuals and providers. BEADS analyzes the incident reporting data to identify areas of improvement, to address adverse trends and patterns, establish interventions that are proactive, and use data to identify opportunities for prevention and to mitigate incidents from occurring. Any individual, guardian, family member, and/or community member has the right to file a complaint on behalf of an individual receiving waiver services through BEADS. Complaints are broad in type and scope and can be specific to one individual, a group of individuals, or a provider. It is not intended to replace incident reporting, but instead is an additional venue for identifying and addressing issues when other monitoring activities appear to be ineffective. Thus, it is possible for an unresolved incident to become a complaint. There is information on how to file a complaint using our online complaint form or by calling our 800 number, which is 800-545-7763. If you or a loved one lives in a supervised group living setting, also known as a group home, or a comprehensive rehabilitation management needs facility or CRMNF, complaints should be filed instead with the Indiana Department of Health's long-term care. As a follow-up, if you think of any questions after tonight, please feel free to send us an email through our BEADS helpline. That is bds.help@fssa.in.gov. Thank you very much for your time. And if you have any questions, I'd love to try to answer them.
So I do want to open it up to questions right now, but I also want to mention a couple of things. You know, when we talk about incident reports, you know, we often tend to focus on abuse, neglect, or exploitation, in part because those are the things we absolutely want to make sure somebody is looking into. But that's not the only reason that you would that an incident report may be filed. There are other reasons why an incident report may be filed, and there are a lot of things that the state does with incident reports, but there could also be some things that a family may use that documentation of incident reports for. So for example, let's say you have a loved one who over time, maybe as they're aging, you know, maybe they're getting a little less stable with their mobility, and they're having more mobility issues. They're falling more often. Well, having that type of documentation may also help, you know, get orders for some other types of mobility devices or physical therapy, or even a wheelchair if necessary, because we've got that documentation showing that those things have been happening. If you have a loved one who is maybe getting mental health services, whether it's through a community mental health center and they're getting what's called MRO or Medicaid Rehabilitation Option services, or maybe they're going through the Children's Mental Health Initiative and getting services that way, making sure that certain things are documented helps not just their waiver team address issues, but also helps anyone else who may be working with that individual, whether it's their MRO service providers, whether it's their CMHI providers, or whether it's even teachers that they may be working with in school to help them understand some of the things that are going on too. One of the things that I also recommend when we have individuals who are trying to apply for supplemental security income for the first time, if there are relevant incident reports that may help document or show the extent of a person's disability, That could also help Social Security be able to recognize that when they're making their determinations on disability. So while the state, through the Bureau of Disability Services, absolutely needs to know about these things, and they do a lot of things with incident reports, at the same time, there could be some other things that individuals or families may be able to use those incident reports for as well to help improve the quality of life for the individuals. And so at this point, let me look to see, by all means, go ahead and put your questions in either the Q&A or in the chat. Right now, I don't have any yet. But, Kim, I want to ask you, because sometimes as I'm talking to families, one of the things that may be happening is that, maybe there's been an issue with a direct service provider, and they don't think that their loved one has been treated appropriately. Um, when is that something that should be, when is that something that should be reported, and how should that be reported? And when should it be an incident report versus a complaint? Can you kind of talk about that a little bit?
Sure. So, first of all, if a family ever wants to file a complaint, they absolutely can do so. And, there's not a requirement to file an incident report first, or for the family to reach out to the proper entities to file an incident report. They do have that right to file a complaint at any time. I would encourage them to reach out to any member of their team at any time if there is any suspected allegations. You do not have to be sure that something occurred. If you suspect, I would encourage you to make sure that an incident report has been filed, or a complaint. Like I said, if you want to just go that straight to that route, you do have that option.
And Kim, do people only file those if it involves like a service provider, or what if something just happens at home? Is that something that should be shared as well?
Yes, our goal is to ensure the health and safety of the individual, regardless of where the incident occurred and who the incident occurred with. Of course, when we are considering the follow-up questions and what information we need to get from that particular incident, we do keep in mind the where, when, why, how of the incident. But we want to get a whole and complete picture of that individual and do everything that we can to mitigate any future risk to that individual, or just like you said earlier, improve the quality of their life. And sometimes that can be better done by having that information that we otherwise wouldn't have.
I think a lot of times people only think about incident reports if something has happened where blame needs to be assessed, and that's not really the right thing, is it? One of the things that I want people to know too is that sometimes it's filing an incident report really so that there's documentation about something. So maybe somebody has tried a new medication and there have been adverse reactions to that medication. I think a lot of us have had situations in our lives where with our loved ones, we've tried a new med and we realized, oh, that's not the right med for them. Having that documentation is good, so that we know, and we've got that documentation of, hey, let's not use that medication again because it had some pretty substantial side effects. Or like I was talking about earlier, when we have those situations where maybe somebody's mobility is just declining, and we have situations like that, or maybe there are all sorts of different things. Incident reports aren't just about somebody doing something wrong. Incident reports are really just to document, hey, something happened, so that we can try to figure out why and try to make sure that either it doesn't happen again or that we've got the right supports in place. Am I right in how I describe that?
Yes, I would say that's spot on. If an individual, they're all of a sudden falling a lot, regardless of that setting, right? If they're falling a lot, then that helps give a full and complete picture to find out, hey, how can we work together as a team to try to see what's going on? Do we need to add certain safeguards? Do we need to have the home assessed for modifications? Whatever whatever the case may be for that particular example, that getting that full and complete picture helps that individual to get those needed supports in place, or could help to get those needed supports in place.
We do have a question that's come in. At this time, are we still required to file incident reports for clients who contract and test positive for COVID?
Yes, until, is it November 11th? Is that the date? Until the Appendix K flexibilities are completely over on November 11th, those are still required to be filed.
And that's just frankly, that's just a good idea, just to make sure that everybody in that person's, in that person's world is staying safe, and that the individual is getting the treatment that they need as well.
Absolutely.
What are questions that we have out there? Kim or Shelley, are there some other things that as we've been talking, that you're thinking about that you want to stress?
Thank you, Carly. I want to just add a couple pieces here. I know sometimes there is a fear about incident reporting and how it might be used against someone. And please understand that is not the intentions by beads of any, we're not out to get people with incident reporting. We do really want to use the information we get to help individuals have better lives, right? And sometimes by collecting that data, we can see patterns that if you're in the weeds in that home or whatever, you may not see what's there, because it's seeing the trees from the forest, whatever that analogy is. So incident reports, we have a defined list of those things that have to be filed, right? They're in our waiver, they're in our code. We've told the feds, CMS, that we're going to report this stuff, because it's how we ensure health, welfare, and safety. So as far as it comes from our perspective, those are non-negotiables. We have to file those, right? But you also have complaints. And a lot of times the complaints we get are where families have went with, had conversations with case managers, their teams. Things are not working, the team's not talking, and they're really struggling. And we get a complaint to say, they're not taking me to the doctor, they're not doing. So then that gets beads involved in a different way to say, okay, let's get some information and find out what's going on, to say, how can we assist? Because we need to have the health, welfare, and safety of these individuals and services to be addressed. But it may be just a whole communication issue. And maybe it's not this full investigation. It may be we want the team to get together and have conversations. So, a complaint is where you've typically tried other things to resolve the situation. Doesn't have to be. You can file the IR, or you can file a complaint, or you can do both. So, we don't limit it to what people want to do. Have to do. It's whatever you want to do to try to get to a resolution. The goal is supporting the individual and making sure that, their needs are being met. They're having a meaningful life with, the quality of life that they want. So, I'm not sure if I explained it well, but, that in a nutshell is the difference between an incident report and a complaint.
Well, that's ironic, because as you were starting to talk, somebody wrote in with the question. I'm still a little confused about the difference between incident reports and complaints. As a family member, am I supposed to file a complaint and not an incident report? Let me, and I don't know if we've already answered your question or not, but maybe is it, if it's a specific, I don't want to use the word incident, if it's a specific action or activity or thing, that may be more of an incident report. But if it's more of a general, more of a general issue, would that be more of a complaint? Not necessarily.
Individuals and families do not have to file incident reports. They are not mandated reporters. So the individual, or the,
right?
They can file an incident report but they are not mandated to do that. So if they have an issue, they can go straight to a complaint route at any time. So, it really is up to the individual in the situation. If they, I would say a complaint would get, we get almost 6,000 incident reports a month. So to get that triggered as an issue that we need to follow up even more in depth on is less likely than a complaint that's going to come in. So if there is a situation with the family that they think they need an immediate response and they need somebody to intervene, the complaint's probably going to be their best route. I'm not sure if that helps or not.
And by the way, she mentioned that they get about 6,000 incident reports per month. That's out of more than 35,000 people. So and sometimes incident reports are also for kind of things like, accidentally missing a dose of medication or something like that. That would be another, incident report that may be filed. So I think a lot of times people assume that it's always going to be abuse, neglect, or exploitation. Sometimes it can be that simple mistake, or something along those lines too.
Absolutely. I mean, I forget to take medicine, so it happens, right? But when you have a staff person responsible for providing meds, is the medication error because they forgot to give it to you one day? Okay, that can be a problem. But is it because the provider didn't get the meds filled? And that's why there's no meds, which is a different kind of problem, right? So it's through the incident reporting, we can start seeing those patterns where we're having problems.
I'm new at working with an organization supporting people with a variety of disabilities. Am I going to expect to be trained in this?
Anyone working for a provider that is working with individuals must be trained in incident reporting prior to working with an individual. Your question actually gives me a little heartburn because it is a requirement that you are trained before you work with individuals, because it is such a critical piece of the puzzle. So yes, I mean, if you are actually employed, you should be trained in incident reporting.
And our person who was asking about the difference between incident reports and complaints followed up and said that was very helpful. So thank you. I did see that somebody had their hand raised. The only problem is I don't have a way to unmute you. So if you could put your question either in the Q&A or in the chat, we will absolutely answer it. But I'm going to give them time to type because I know I am a slow typist. So when an incident report is filed, and especially when it is something that is, that is along those lines of an abuse, neglect, or exploitation, what actually happens at that point?
So of course there are those required members of the team, as well as APS or CPS, that have to be notified immediately.
And by the way, APS is Adult Protective Services, because there is Adult Protective Services as well as Child Protective Services.
Yes. And sometimes that's, calling their hotline and just, and then it can be up to them whether or not they want to look into it further on their end. But particularly if there is a provider responsible at the time, or if the individual is just supported by a provider, then there are some other immediate protective measures that need to be in place. If the abuse, neglect, or exploitation, alleged abuse, neglect, or exploitation occurred from a staff person, for example, then one of those immediate protective measures would be that we will confirm that staff person has been suspended during the investigation, just to make sure that individual is safe in the event that alleged event did in fact happen. So we need to make sure that is not unsubstantiated. That other immediate protective measure is that contacting of APS or CPS. There may be other protective measures, that may be in place depending on the severity and situation of the what happened to the individual. Did
So
that
we've got,
answer your question?
you did.
Okay.
We've gotten another another question that has come in. Does Beats track those clients that have been asked to leave following a complaint?
I'm sorry, can you say that again?
Does Beats track those clients that have been asked to leave following a complaint?
Do you mean that a provider served notice because an individual filed a complaint against them? Is that, I don't know that I understand the question.
Well, I don't know either because that's all that's written.
Okay.
One of the other things, while I'm sure she's going to clarify that here in a moment. One of the things that I also want to point out is that in this past legislative session, one of the laws that passed was that there will be a new registry for direct support professionals. And so now there is another way to track some of these things. Ladies, I'm putting you on the spot. I don't know if either of you are able to talk about and the registry has not been created yet. Okay. So in part they are in the middle of designing that and figuring out a lot of the logistics and more importantly the specifics on what all that will look like. I don't know if you guys are able to talk about that at all. I'm
Quite
totally putting them on the
honestly,
spot, and that's not nice of me.
Carla, we don't have information at this point. As you mentioned, we are in the very initial stages of what that's going to look like. So, it's a big undertaking. The first part is a curriculum for all DSPs that will be, and then the DSP registry is the second phase of that. So I think they're trying to figure out how to work that with the change in the waivers and everything that's happening. So more to come. It's not a bad thing. It's just a lot to try to figure out all the logistics of.
And to start something like that from scratch, there's a lot involved with that. And one of the things that BEADS is also doing, especially when it comes to direct support professionals, is trying to make sure that that they are getting training and getting access to training to help them with their jobs as well. So they're trying to create a more robust training program for those direct support professionals, so that those DSPs feel more confident in what they're doing, and so that, and basically to try to help profession. Well, that was going to come out wrong. To try to make this more of a career, and really make this more of a profession than just a job. And so our person who was asking about does BEADS track those clients who have been asked to leave following a complaint? She says, yes, of course, they would not admit yes, they would not admit that was why they asked the client to leave. May use the inability to staff involved, quit, etc. I think what they're trying to say is, if there has been some sort of incident, and I believe that what they're saying is, the agency has served notice. Is there kind of some follow along with that individual to figure out if, if some of those things are still occurring, if companies are using a history of incident reports to terminate services, things along those lines. But I've got to admit, I'm kind of trying to figure this out as well.
Well, I'll answer, and then if it's the wrong, answer, I mean, if that's not the answer that you're looking for, just feel free to put that in the Q&A. A provider does have the right to issue a notice of termination of services. However, they cannot quit on an individual. They have to continue to provide that level of support until another provider that's providing that same level of support is secured. So hopefully that does, I mean, we do our very best to, make sure that complainant information is completely anonymous. Can I guarantee that no one figures out I cannot make that guarantee, and I would hope that no provider would ever consider doing retaliation for filing. A provider does not have to give a reason for notice, but like I said, they have to continue to provide those services until another provider is in place providing these same services.
And Kim, I think that's actually what they were getting at
Okay.
is when somebody has filed a complaint and then suddenly the provider says, "Oh, we no longer have any staff for you,"
Yeah.
or "Oh, the staff quit and we just don't have any backups." And you're right, they're not allowed to terminate services until something new is in place.
Yes.
But sometimes that happens. So I think that is so is there follow-up in situations like that to make sure that things like that aren't happening or to try to help out in those situations so that the individual is suddenly not left without any staffing or supports?
Well, I mean, I'm going to jump in here. This
Okay,
is Shelley.
please.
And I would say, there is a staffing crisis, and not
Mhm.
having a staff available happens frequently, whether a complaint's been filed or not. So, sometimes that does happen. Now, if it happens right after a complaint being filed, I mean, yes, it tends to be suspicious. But what I would suggest is if this is happening, they need to reach out to their team. If necessary, reach out to us. We're going to have some conversations with the providers to find out what's going on and how we can support the individual the best way possible. We have to move forward regardless of what happened, whatever that complaint was or whatever, you still have to move forward. And sometimes it's getting everybody on the same page to have those conversations, and they're hard conversations. To say, we need to put this behind us and we need to move forward. How can we do that and do it together to support this person, right? And so, I mean, Kim and I spend a lot of time on the phone with people having these exact conversations because it's necessary.
And she responded. That answered it. Thank you.
All right.
We have another question. Should injuries of unknown origin be reported to CPS or APS, especially if abuse, neglect, or exploitation are not suspected? Yes,
injuries of unknown origin only have to be reported if it's indicative of abuse, neglect, or exploitation. At least that's the way our code reads. So if it is indicative of A&E, which would be alleged A&E, then yes, it would be reported. If you have an unknown injury that looks like somebody bumped their elbow on, the corner of a dresser, is that indicative of A&E? No. Indicative of A&E would mean it looks like a handprint. It looks like, a heel, a shoe heel, things like that would be more, or it looks like somebody grabbed them and squeezed them, things like that.
Yeah.
So it would be the same as alleged abuse, neglect, or exploitation. So yes. And please be clear, you can report anything to APS or CPS.
Yeah.
It could be anything you want. So just because we have a defined list doesn't mean you can't go ahead and report it.
Yep. And I would just add, I mean, Shelley answered the question. Thank you, Shelley. But I would just add, that's why some of those details are so important. And that's why we kind of really talked about the incident reporting details and what should be included in that initial incident report, because like she mentioned, what may appear as a bump on the elbow is going to tell us a lot versus, a heel print style bruise or red, those descriptions are going to help a lot when we are processing that incident report to ask the right questions.
I want to give a last chance for people to ask any questions if they have any. Again, you can put that in the Q&A or in the chat. But I will say this has been incredibly helpful, ladies. So thank you so much for joining us this evening. Especially, especially talking about that difference between incident reporting and complaints and how all of that works is really, really helpful. So thank you so much for that. When it comes to the follow-up, you had mentioned that if there is a legal representative of some sort, that they should also get copies of the outcomes, or get copies of the incident report and also copies of the outcome of that, correct? And is that just a legal guardian? Does that include powers of attorney? Does that include authorized representatives? Who all does that include? Or that's a comprehensive list. Sorry, didn't mean to make
No,
that
that's
comprehensive.
okay. It is largely identified as the individual's guardian over the person. Are there other exceptions to that? Yes. I mean, it really largely kind of depends on the paperwork itself as far as the legal kind of role with that person may have. But if it is a guardian over person, then yes,
Okay.
they always should be notified.
And that would also include the parents of minor children.
Yes, thank you. Absolutely.
All right. Well, we don't seem to have any other questions at the moment. So ladies, thank you so much for taking your time and talking with us today. For those of you who have joined us for tonight's Ask the ARC webinar, I want to thank you for joining us. The Ask the ARC webinars are held the second Thursday of every month. So we hope to see you next month as well. If there are any particular topics that you'd like to be covered in our Ask the ARC webinars, by all means, give us a call at the ARC at 317-977-2375, or send me an email at Carly, that's KARLY, at arcind.org. Or if you have some more follow-up questions from tonight, you can always reach out to Kim or Shelley. You can always reach out to us here at the ARC and talk with one of our family advocates. Or if you just want to talk about a situation involving your loved one and want to kind of have somebody to talk it through, you're welcome to give us a call here at the ARC at 317-977-2375. Thank you all so much for joining us this evening, and have a wonderful night.